Now, several welfare organizations in Diepsloot, north of Joburg, say they've been without electricity for more than a year now. They say Eskom has attributed the problem to a broken transformer due to illegal connections. Newzroom Afrika's Zola Sholwana is there and joins us live. Zola, a year without electricity for these NGOs doing very important work. What does Eskom have to say?
Well, from what we know, Massa, being told by the organizations is that Eskom said their facilities or their NGOs are stationed in an area that has, informal settlements, which means there are a lot of illegal connections. So it's dangerous for them. In fact, one of the organizations says that Eskom says it's dangerous for them to send their technicians on the ground to come and assess the issue. But what I can tell you, Massa, is that it's extremely difficult for these organizations. This organization alone, or rather medical facility, had to turn back 3 patients who came for a sauna in the morning because they do not have electricity. There's so many issues that they are facing. Those that have to receive food from sponsors can't keep the food for a very long time or keep it refrigerated because they do not have electricity. They rely on one generator, which cannot be enough to keep lights on for all these NGOs. There's about 4 NGOs in these premises. But let's bring in a medical, or rather a health professional. Sisi, thank you very much for your time. You work with patients, and this morning you did mention, Uguti, you had to send back 3 patients because of this issue here in Nyongabinagesi. You can speak any language.
Yeah, namusi rodo swika era umisa patient taru nga ndaba yo riba khoda sona and arina mudagasi ari kono vathusa usaba na mudagasi ya zwi rekondisela ushuma ari kono shuma zwavhudi ngori una zwithu zwine zwi ṱoḓa mudagasi una vhathu vhane ri tea u vha thusa nga sona mara sa zwino ari kona ngori mudagasi arina.
So ni survive kanjani for over a year ningena electricity? Ngiyabona ukuthi nine gas lana to keep at least this place warm.
Because len brege iya rothola ri renga gasi rina hita ya gasi ri ya kono ifunga mara I last and happy to rothola the patient is ya complain ngo rothola for the laptop or to charge sa battery rumbelo charge sa fire station ra kono charge sa laptop or kono shuma phone landline so far I shumi ngauri arina mudagasi but wachi rifonela aba kuno riwana.
So yes, committee ni man complaining endaba yo case but bazonlungiselela nini?
Bayathembisa uri badoda mara abadi ba cheka nge transformer chishinyala hone mara bapedza basongoda basokori thembisa uri badoda but bapedza basongoswika.
Thank you very much for your time, Sisi. Well, Massa, that was one of the health professionals in this facility, basically explaining how life has been for them for over a year, essentially saying that now they have to use this gas heater to keep this place warm because when patients come, they always complain about how cold their facility is. If they need to charge their laptops, they have to go to the nearest fire station. Their landline is not working at this point. And they're saying that Eskom has been saying that they're going to come and fix their transformer, but because of the danger of this, or rather how dangerous this area is, that has been delayed. But of course, we'll be getting a comment from the power utility later on as to why these people have been without electricity for over a year, because you understand that this is not only affecting them as employees, but it's also affecting the community of Diepsloot that is meant to be benefiting from their services. Back to you in studio.
Zola, thank you so much. And we also look forward to hearing what Eskom has to say. It was quite disheartening listening to that healthcare practitioner saying, that they keep making these promises, getting these promises by Eskom that they will come and then they don't. So we'll look forward to that update by Zola Sholwana.